welcome back to my channel. Today I thought it would be nice to talk about what it was like to be on the transplant waiting list. Now, I was on the list on and off for about 4 years, which does sound like a long time, but an on and off means that, you know, there were times when I wasn't actually on the list. Yeah, I was still obviously unwell, very unwell, with liver failure, and there were times when I was too well to be on the list, which was, yeah, I did find quite frustrating because I still felt like I needed one, and obviously I'd been through that stage of needing one, but I just suddenly became quite well. But I guess I had it at the right time, and the doctors knew, you know, exactly what they were doing, and they made that decision that I wasn't unwell enough to be on the list. So yeah, it was a bit of a battle with being well, being unwell, then being well again, and then being in hospital, out of hospital. It was a very challenging time because, you know, through that whole time actually I couldn't succeed in anything. Like, my career was just on a bit of a hold. I couldn't work full time. I was exhausted and I felt very unwell. I had a lot of tablets to take, and overall I just felt awful. But in the end, I had my transplant when I was put back on the list, and it took me about 4 months to wait for it, so I was quite lucky to actually have had it. Now, I remember the day quite well actually. It was on a Thursday. Yeah, it was on a Thursday, and I actually had blogged that day on my blog oliviasliver.co.uk. It was just about the dog and, you know, what I was doing, and I was just a bit fed up. And I just started to think, you know, during that time, I just, you know, is it going to be my turn soon? But that question is always in the back of your head when you're waiting, because you always want to know, like, where you are on the list and how long it's going to take, but no one can answer those questions. No one can answer those questions at all. It's like saying, how long's a piece of string? No one knows, because you never know how long it's going to take for that donor to come up and whether the liver's good enough. Sometimes you get a call and it's not, you know, a right match for you. It's not good enough for you. You know, that the doctors won't transplant you when the liver's not good enough. You know, they just won't do that because they respect, you know, your health, your life, and they just won't do something so risky. And that risk may lead to, you know, further complications down the line and another transplant. So there are times when you will be called and it won't be good enough. So one tip I have for you is that if you are waiting on the transplant list at the moment, just try and remember it may not happen to you that time, and just have in the back of your head, you know, it may not happen. And that's what really got me through the time when they called me and it wasn't a match. And then about 2.5 years later, I got the liver after that. But that's because I was off the list during that time and then back on. When I actually had that call when it was not good enough, it's because I was either going to have a split liver or a full graft that had been from a very young child or baby, possibly, because the liver that's transplanted actually does grow to fit your size. So because I had a split liver, it's not quite the same shape as a normal liver. That day when I was called in, the day that I actually had my operation, and it was, you know, successful and everything went through and everything was fine, I had actually gone upstairs that day and got changed into my pyjamas, and as soon as I had started getting changed in my pyjamas, the phone rang, and it was a transplant coordinator, and it was a number from the hospital, and I just thought, okay, what is going on? What's this? I bet it's something like, you know, just checking how I'm getting on, or I don't know. I wasn't sure whether it was going to be the call, but in the back of my mind, I had a good feeling that it was, because they just don't often call. Like, the hospital don't often call. You know, they assume you're okay unless you call them and, you know, say that, you know, you don't feel very well and things like that. So yeah, I was fine. They didn't really need to check up on me. I was working part-time still, but my bloods were just awful. Just terrible enough to need a transplant. And I do believe that it was my willpower that just got me through, complete motivation that just got me through, being able to work, being able to manage every day. I am just quite a determined person, so I always try and make sure that I'm able to go above and beyond and just push myself. And sometimes that's not always a good thing, you know, pushing yourself too far, pushing yourself too much. So when they phoned me, they said obviously it may not happen, it's a brainstem death donor, which is the best type of donor. I mean, both are fine, but for a young person like myself, you know, they wanted the best quality liver, and they wanted to give me a great opportunity, you know, to live the rest of my life, because, you know, I was still in my 20s, I still am, and this was just over 2 years ago that this all happened. It's still quite a scary thing to think about, that I even, you know, went through that. So they called me and they said, don't come in yet. I lived about 15-20 minutes down the road, so it didn't take very long to get there, probably less than that. You know, we were driving in the night, not in the middle of the night, just in the evening, and it didn't take long to get to the hospital. But before they told me to come to the hospital, they told me to eat. I was more excited than anything, because, you know, this could be it. But obviously I don't want to get too hopeful. So I had something to eat, didn't manage too much because I just lost my appetite all of a sudden. They said that once we get more information, we'll call you. I didn't call my parents at that point because I didn't want to get them ready, get them like excited, because I didn't know whether it was definitely going to go ahead at that point. So then they rang back maybe an hour later and said, you know, this seems likely to happen. So I had my already pre-packed hospital bag, and we just drove to the hospital and went up to the ward they told us to go up to, and yeah, it just happened so quickly. I rang my parents came as soon as I got to the hospital. The surgeon came in, the transplant coordinator came in, a nurse came in, I had my bloods taken, I phoned my sisters. Yeah, everything was good to go. I put a gown on and I put those beautiful stockings on. I just went down to the operating theatre. I was looked after very well. You know, everyone was so polite and so friendly. It was great. I remember such positive things from that point. I really do. And even afterwards, like, I really do remember very positive, supportive moments. They looked after me very well as soon as I came out from theatre. I remember critical care. I remember the nurses looking after me really well. My family coming to visit. You know, I was just still very, very all over the place as soon as I come out of operation. And, you know, you don't wake up as soon as you come out. You're still tubed. You're still under anaesthetic because you are likely to be in a lot of pain. And actually they had to extubate, so take the tube out from me. And because I was in a lot of pain, they tried to give me pain relief. That didn't help it too much, but so in the end they just put me back to sleep. So that can happen, which is fine. You know, it's just that, you know, your pain's too much to tolerate. I guess because I'm smaller and it being quite a big operation, and then I had already an operation when I was very little, that it takes a lot of time to do that operation, especially when you've already had a previous operation. So scar tissue, your anatomy is different, and so it can take a few more hours. I do believe it took about 8 or 9 hours. Everything went really well. I remember waking up, I was comfortable. I didn't really have anything to eat at this point. I had a tube in my nose because they were feeding me through that. You do lose a lot of weight after transplant because, you know, your body's trying to repair, and you need the excess calories to support that amount of energy you need. It is quite hard to eat though after transplant, because, you know, your stomach is the place where they've operated on. Your stomach is where the food's going. You may be full of gas, you may feel bloated. I mean, you're definitely going to feel bloated. It's going to be sore in that area, you're going to feel inflamed in that area, and it's just going to feel weird. So just start slowly, but always try and, you know, do your best to make the most of, you know, eating as much as you can. But was this one video where I'm literally just half asleep picking up a spoon of food, and I slowly pick it up and I'm just like, just taking ages to bring this spoon up to my mouth. Just because I'm half asleep, you know, everyone's trying to encourage me to just take a bit more and more and things like that. So it's weird, it's really strange. Yeah, you're on a lot of drugs. There is a pain relief that you will have, which is a drip attached to this pain relief drip, and what this does is you press a button and every 5 minutes you're given a small dose of this drug, either fentanyl or morphine, usually the most common ones, and I had morphine. And so every 5 minutes I was able to press this button and I was able to get morphine. So whenever I felt like I needed that pain relief, I was able to control it myself. So once you come out of critical care, you go to a ward, you go to one of the liver wards. They will look after you for about a week, or sometimes a bit longer, sometimes a bit shorter, and they'll build you up from there. They'll go over all the medications that you'll need to take, make sure you've got your family around you within that time to get all that information, you know, to be educated on that. I know that it wouldn't be possible if you were to, you know, have a transplant in this moment in time. I'm sure your family will get that information. They'll be able to call you, you know, whilst you're unable to visit your loved one who is having that operation, or if your family is unable to come due to COVID. And I've got a friend who's had a transplant. Her family are unable to actually visit her right now, which is very sad because I really relied on support of my family. But I mean, how lucky is it that she's been able to have that second chance at life? You know, how amazing is it to be able to live in this day and age when they can actually perform those operations? It's weird just to think about it. Like, even now, just reading over my blogs, and so in my current blog you're able to read over my journey through that transplant operation. So if you need more information about it, or if you want to know a bit more about what it's like to be on the list, then please let me know. Drop me a message. My Facebook and Instagram is there down below if you need any more information. After my operation, like, I was fine. I mean, I did have a complication. I was given that day, you know, given a new chance of life, given, you know, from that donor who gave me that opportunity to be able to be here now, you know, and be doing what I'm doing, and being able to support other people who are going through this, because I really struggled to find any support when I was waiting, and I really wish I'd found some kind of patient experience. I was really, really desperate for that information, but, you know, I was able to talk to other people. I had so many questions to ask, and I really wanted to know what I was going to go through. And you get information from the doctors, from the nurses, from transplant coordinators, from the dietitians, you know, from everyone who is actually part of that team who are looking after you pre and post transplant, but never a patient experience. I believe I'm hugely lucky, and I know I was born with my liver disease, and I didn't have a huge chance at, you know, surviving after my first operation, but it's just crazy how far I've come. I'm trying to achieve, you know, as much as the next person, but when you go through so much in life, if your health's not great, then a lot of other things suffer. It is hard to go through that time, you know, especially as a young person, when you've got those plans in life, you know, you've got those aims, and you can't do that because of, you know, health reasons. And but once you get that chance to live again, then, you know, I really appreciate it, everything. It's been just a crazy journey, really has. If you would like me to do any other videos, and if there's anything I can do to support you, just, yeah, drop me a message. I'll be happy to help. And please subscribe so I can spread this information to whoever needs it, and, you know, so that I can say that I do my job well. Thank you for watching. I'll see you in the next video. Bye!